Welcome to this medical and anatomy quiz by AnatomyExplora. You'll face 40 questions across 4 rounds, covering everything from body systems to clinical facts and visual recognition. Some questions will test what you know, others may surprise you. Bar graph. Before we begin, take a moment and ask yourself, how many of the 40 will you get right? Type your guess in the comments, then test yourself and find out. Let's get started. Round 1 begins now. Let's start the quiz with 2 connected rounds. First, 10 multiple-choice questions, choose the best answer. Then, 10 open questions, no options, just your knowledge. Stay sharp. Round 1 begins now. How many bones are in the adult human body? Answer B. Which blood vessels carry oxygenated blood away from the heart? Answer B. Which muscle is primarily used during breathing? Answer A. What type of joint is the shoulder joint? Answer B. Which hormone regulates the body's metabolism? Answer B. Which part of the brain controls voluntary movement? Answer C. What structure connects muscle to bone? Answer B. Which body system includes the spleen and lymph nodes? Lymphatic system. What is the function of red blood cells? Answer B. Where is the patella located? Answer C. What condition is characterized by the progressive loss of cartilage in joints? Osteoarthritis. Which autoimmune disease causes widespread muscle pain and fatigue? Fibromyalgia. A stroke in the left hemisphere of the brain typically affects which side of the body? Right side. Which lung disease is commonly associated with long-term smoking? Chronic obstructive pulmonary disease. What is the medical term for a slipped disc? Herniated disc. If you want a short break, you can pause it here before you go further. What is the primary symptom of sciatica? Radiating pain down the leg. Which test is commonly used to diagnose an ACL injury in the knee? Lachman test. What condition results in bone weakening and increased fracture risk, especially in elderly? Osteoporosis. Name a common overuse injury in runners affecting the anterior lower leg. Shin splints. What neurological disorder is characterized by tremors and slowed movement in older adults? Parkinson's disease. Welcome to round 3. This round is all about visual recognition. You'll see an image of a body structure. It could be an organ, a bone, or a specific region of the body. Your task is simple. Look closely, and name what you see. You'll have a few seconds to answer, so stay focused and trust what you've learned. Let's begin. What is the name of this structure? Cerebellum. What is the name of this structure? Pancreas. What is the name of this structure? Ulnar bone. What is the name of this structure? Meniscus. What is the name of this structure? Limbic system. What is the name of this structure? Infraspinatus. What is the name of this structure? Achilles tendon. What is the name of this structure? Adrenal glands. What is the name of this structure? Humerus. What is the name of this structure? Temporal lobe. Welcome to round 4, and this one's all about speed and instinct. I'll give you 10 statements about anatomy, medicine, and injuries. Some are true, some are false. Your job? Decide fast. You've got 5 seconds per question. No time to hesitate, just trust your brainstem. Let's begin. Humans have fewer bones as adults than as babies. That is true. You can survive without a spleen. That is true. Hair and nails keep growing after you die. That is false. The human nose can remember over 50,000 different scents. That is true. You only use 10% of your brain. That is false. Your heart can continue beating outside the body for a short time. That is true. Sneezes can travel faster than 100 kilometers per hour. That is true. Swallowed chewing gum stays in your stomach for 7 years. That is false. It's impossible to tickle yourself. That is true. The tibia is located in the arm. That is false. That concludes today's quiz. You've just completed 4 rounds, with a total of 40 questions covering anatomy, medical knowledge, and clinical reasoning. Whether you're preparing for exams, reviewing the basics, or testing your current understanding, thank you for taking the time to challenge yourself. Feel free to share your score in the comments below, or let us know which round you found most difficult or most useful. If you found this video helpful, consider liking it and subscribing to the channel. We'll continue posting content focused on anatomy, medical learning, and visual-based education. And don't forget to turn on notifications if you'd like to be updated when new quizzes or tutorials go live. Thanks again for watching Anatomy Explora. Stay focused, keep learning, and we'll see you in the next video.